good evening, everyone. We are so glad to have you with us tonight. My name is Charlene, Margot, and I'm the co-founder of nonprofit, The Parent Venture, the organization that brings you this program, the Parent Education Series, now in its 16th year. We could not be more delighted to have with us Dr. Tauheed Zaman, who has been with us in some prior events, but tonight it's a new topic. We're going to be talking about cannabis and tobacco, a practical guide for parents and caregivers. So before we start, I'd like to say that we will have simultaneous Spanish interpretation, and I'm going to ask our interpreter, Trini Lara, to join us to explain how to do it in Spanish. Trini. Muchas gracias, Trini. We appreciate that. All right. We also would like to say a special thank you to the TUPE, Tobacco Use Prevention Education Program of the San Mateo County Office of Education, who are sponsors for tonight's event in partnership with this organization, the Parent Venture. Special thanks to tonight's featured presenter, Dr. Tauheed Zaman. Again, I'm going to tell you about him in just a minute. Most of you are probably familiar now with the Zoom webinar format, but we want to tell you that there's two ways tonight for you to interact with us. The first is the chat button that I know most of you are familiar with. So you may be asked to put some things in there to interact with us. My partner, Bev Hartman, will be putting resource links in the chat. Look for that, along with a short survey at the very end of the presentation. So comments and interactions in the chat, but we'd like you to put your questions in the Q&A. Feel free to ask questions at any time during the presentation, but we will save 10 or 15 minutes at the very end to hear from you. So please do ask away. We'd love to hear from you. Tonight's event is being recorded and will be available on our video library with the link for those of you who registered for this event. Okay, on we go. Let me tell you a little bit about Dr. Zaman. Dr. Tauheed Zaman is an addiction psychiatrist at the San Francisco VA and Kaiser San Francisco. He is also an associate clinical professor at UCSF and serves as associate director of the university's addiction training program. He serves in several leadership roles at the California Society of Addiction Medicine, has worked on cannabis policy and research, and cares for many patients with cannabis and nicotine addictions. He completed his addiction training at UCSF and his psychiatry residence at Harvard Medical School. Please join me in a really warm welcome for our friend, Dr. Tauheed Zaman. Thank you, Tauheed.
Thank you so much, Charlene, and everyone for the warm introduction. And thank you to all of you for being here. I really have an interest in making the science behind tobacco and cannabis and some of the medicine behind it accessible to everyone. And I hope that I'll meet that goal today. And I'll be focusing on adolescent tobacco and cannabis use. As I start off, many who have seen my talks before will know that I like to start with this image. So this image on my opening slide is from Haight-Ashbury, which is a notorious neighborhood and a famous one in San Francisco, where I lived for some time. And it's known for being kind of a cultural hotspot and a place where there are, in fact, a lot of adolescents using both tobacco and cannabis. And they were, all around me. And it was an interesting place to live as an addiction psychiatrist. So it really drove home for me the fact that we really need to be talking to adolescents in our communities, in our schools, elsewhere, and of course to their parents about tobacco and cannabis, given how common use is out in our communities. I should also mention that I have no conflicts of interest to disclose for this talk, which means that I am not sponsored by any pharmaceutical industry related to tobacco or cannabis. So I think I would like to start with a question, which is quite broad. I don't think I have to convince this audience of interested parents and educators that tobacco is bad for adolescents. But why is tobacco use bad for adolescents? And I would invite you to just put a couple of answers in the chat, and I'll kind of take a look as we go. So any guesses as to why tobacco use is bad for adolescents? Charlene, I say yes, can be addictive. Addictive is they're bad for lungs and cancer. Yes, certainly inhaled forms of tobacco, what we call kind of the smoked forms of tobacco combustible products. Yep, Amanda, thank you for mentioning interferes with brain growth. That's something we'll actually talk about because adolescent brains are actually developing to a much later age than many of us think sometimes. And so brain growth can definitely be an issue. We'll talk about in regards to both cannabis and tobacco. Any other guesses or thoughts? What worries you? Why is tobacco use bad for adolescents? Yes, thank you, Monique. Societal costs like pollution, that is actually tremendous and hard to measure in terms of the overall cost to us as a society, both in terms of pollution and healthcare costs. So thank you all, and I'm going to continue, but please, when I kind of pause and ask you questions, there are several of them along the way, type in your best answer, and I think you'll get more out of this talk. And so I wanted to share some key facts about tobacco that kind of tie into why we think it is harmful for adolescents. So this is from the American Lung Association. And it's important to know that really each day, a staggering amount, about 2,500 children, so defined as being under 18 years of age, try their first cigarette. And of that group, more than 400 of them will become regular daily smokers, and half will ultimately die from this habit. So talk about both the individual impact and the societal impact. These are huge numbers. And the reason we're talking about adolescents partly is that early smokers are more likely to develop a severe addiction to nicotine at some point in their lives. Of adolescents who have smoked at least 100 cigarettes over their entire lifetime, most of them actually report that they would like to quit, but they're unable to do so. So that's the other thing, is that later in life, it can become harder to quit, despite the impacts of tobacco on so many other aspects of health and functioning. And also, this will continue to be a problem. It's not going anywhere anytime soon, unfortunately. So if current tobacco use patterns persist the way they are, an estimated 5.6 million of today's youth, so again, anyone under the age of 18, eventually will die prematurely from a smoking-related disease. So I think many of you know about the harms of tobacco, but just helpful to have this kind of snapshot of why we think it's harmful. This also brings us to our first tobacco question for the audience. So many of you have kids who take multiple choice tests all the time. Some of the adolescents I work with call them multiple guess tests, which I totally appreciate. So I would like to ask you this question, and by the end of this section, you will know the answer. Approximately what percentage of high school students report current tobacco use? And the options are 50%, 25%, 15%, or 5%. Go ahead and put your best guess into the chat. Okay, Veronica guesses 25%. Monique, 25. Any other guesses? Let's see a couple more, 25, 50, 15, 55. Okay. I see a couple of 25. It looks like 25, 15, and 50 have it, and in particular e-cigarettes. Great point that e-cigarettes have absolutely played a role in adolescent tobacco use. So we're going to spend some time talking about e-cigarettes today. Thank you for your guesses, and let's see what the answer is here. So one important piece of information is that when we look at national trends in use, there are many surveys that kind of try and capture that information. One of the best known surveys is the National Youth Tobacco Survey, and these are results from 2020. And interestingly, this compares data from 2019 and 2020. The 2019 data is in yellow, the 2020 data is in blue. Now, important to note that actually, overall tobacco use among high school students dropped between 2019 and 2020. Now, I want to take that with a grain of salt, because even though overall use of tobacco dropped, and that is absolutely a good thing medically, from a public health standpoint, all of those things, rates still remain particularly high. And you'll see in the middle there, e-cigarette use still actually remains fairly high. So let's look at these numbers some more. This table is comprised of data from the CDC. Again, this is all data from 2020. And they talk about rates of current tobacco use in middle school students in 2020. And they define current tobacco use as being used anytime in the last month. Now, these are kind of a lot of data, so I just want to highlight the important piece for you, which is when you look at the overall percentage, 6.7% of middle school age students reported any tobacco use in the last 30 days. And you can see over on the right, it's broken down by girls versus boys, and the numbers are fairly similar. Now, I think it's important to compare this to what the high school data looks like. So this is all that same information. How many high school students in 2020 reported current tobacco use? You can see that that number has jumped up from about 6 point something% to nearly 25% or 24%. So what we see is that going from middle school to high school, the rates of tobacco use really do go up quite dramatically. So it's close to 25%. And again, girls and boys are roughly equal. The other piece to note here is part of that increase of use is caused by e-cigarettes, right? So someone pointed out e-cigarettes in the chat earlier. You can see that e-cigarette use goes up to kind of nearly 20% or even a bit higher in high school. So e-cigarettes are of particular concern. So getting back to our tobacco question 1, so I promised you all that you would know the answer. Approximately what percentage of high school students report current tobacco use? The answer is just about 25%. So I hope that that makes sense to you all. But let's continue to talk about it. We were talking about e-cigarettes, and many of you may know that e-cigarettes, of course, controversially come with many different kind of flavored offerings. So this is my tobacco question 2 for the group. In 2020, approximately what percentage of high school students reported using flavored e-cigarettes? So of all the high school students using e-cigarettes, how many of them were using flavored e-cigarettes? And the options are 8 out of 10, 10 out of 10, 7 out of 10, and 3 out of 10. Any guesses? Please put those in the chat. Amanda, you guess. I see a couple of 8 out of 10s, 10 out of 10s. Okay. Cecilia also guesses 8 out of 10. 10 out of 10. Bridget, you say parents won't recognize. I have heard that before, that parents may not recognize the scent or of the product, which adolescents are very savvy about. Ingrid, Gustavo, I see those same guesses. So let's talk about it. Let's talk about e-cigarettes and kind of flavored use and why we think that's problematic. Lolanda, I see you guess 7 out of 10 as well. So we're all guessing pretty high. So here are some of the data. This is now data from the FDA in 2020. And when you look at kind of the breakdown of current tobacco product use among high school students, you can see that again, 23.6, so nearly a quarter of students report using a tobacco product, and 19.6 of those students, 19.6% actually report using e-cigarettes, followed by cigars, cigarettes, smokeless tobacco, which are kind of chew or oral forms of tobacco, hookah, etc. And so e-cigarette use is really quite common in high school students is kind of the takeaway here. This is what a lot of kind of common e-cigarette products look like. So there are disposable forms that you can see there on the left, really intended for limited use for kind of one or a limited number of times, and then they can be easily discarded. And then there are kind of less disposable forms. And so these are kind of cartridge and tank systems. So these are rechargeable systems. These are vaporizers that have cartridges that can go into them with different concentrations of fluid containing nicotine. And these can be charged using some of those common chargers on the right. So they're less disposable. And adolescent e-cigarette use has gone up dramatically. So when we look among high school users, when we look at current e-cigarette use, when we compare on the left there, frequent use, which is defined as 20 or more days in the last 30, you can see 38.9% use e-cigarettes frequently. And then when you look at daily use, you can see that that number is a bit lower, 22.5, but still high. So e-cigarette use is high amongst high school students. And when we look at the flavoring question, more than 8 out of 10, so more than 80% of youth who use e-cigarettes use flavored e-cigarettes. And this is really significant because there have been state level and even kind of more regional legislation trying to get rid of flavored tobacco for particularly this reason, because it may actually constitute marketing to adolescents and increase the risks that adolescents will use. So that's why you may see legislation out there aimed at flavored e-cigarette use, because it's so common amongst adolescent users. You saw me mention earlier kind of disposable forms of use versus those rechargeable vaporizers or e-cigarettes. The takeaway from this, and this is again data from the FDA from 2019 and 2020, is that disposable e-cigarette use has gone up dramatically the last few years. So you can see it went from 2.4% among high school users to 26.5%. And then in middle school e-cig users, disposable use went from 3 to 15%. So the takeaway here is that a lot of high school users increasingly are not just using those rechargeable types of e-cigarettes, but also using disposable forms. So there has been some movement towards maybe even trying to get rid of disposable forms or make them less accessible to adolescents. I see a comment from Ingrid in the chart saying high school students in classrooms just asked to use the restroom so they can smoke. I worked in a middle and high school for 15 years as a special ed assistant, so I had the freedom to see a lot. Very true, right? So part of tobacco or nicotine being addictive is that students often need to use throughout the day, and it can certainly show up that way. Ingrid, thank you for sharing. So the other thing I always worry about as a kind of an addiction medicine doctor is, what about multiple products? Who are the people who aren't just using one type of product or one type of tobacco, but using multiple types, maybe using cigarettes and vaporizers or cigarettes and chew tobacco? Well, this is actually of increasing concern. In 2020, among middle schoolers, about 3 out of 100 used 2 or more products. And in high schoolers, that number goes up to about 8 out of 100 use 2 or more tobacco products. And this is a huge concern because even though these aren't huge numbers, using more than one product is actually a huge predictor of developing physiologic, so physical dependence on nicotine at some point in the person's life, and also continuing to use as an adult. So we are seeing some concerning amounts of use of multiple products amongst adolescents. So that is also of some concern. So I'm going to return to my tobacco question that I asked you all. In 2020, approximately what percentage of high school students reported using flavored e-cigarettes? Many of you guessed correctly. The rest of you were very, very close. It is 8 out of 10. And so that remains of concern for the reasons that we just discussed. Okay. Next, and I think this may be my final tobacco-related question for this group, but I would love to talk about which factors actually affect adolescent use. And there are 4 options here. Is it social and physical environment? Is it biological or genetic factors? Is it mental health and particularly their own mental health issues that they might have alongside their tobacco use? Or is it personal views on tobacco? Monique, you guess all of the above. And yeah, anyone else have any guesses about this at all? Amanda, all of the above. Lolanda, you say social or 1. Bridget, you say all. Okay, any other guesses about this? Social and physical. I think particularly amongst adolescents, when the social parts of their lives and their brains are developing, peer groups, the importance of kind of friends, best friends, etc. I think everyone is kind of looking at social as being a big part of this, or all. Myra, you say 1 and 3, so social and mental health. Okay. Veronica, you guess all. Okay, any other guesses from this group at all? Okay, well, let us continue. These are all excellent guesses, and thank you all for participating in the chat. We will circle around and find out the best answer. So it's important to know what exactly constitutes some of these categories, right? So if we're talking about the impact of the social and physical environment, what do we mean? And so these have actually all been studied separately. Now, when we say social and physical environment, there can be many components of that, but the parts that have been studied include media normalization. So that has to do with seeing not just kind of advertisement around nicotine or tobacco use, including increasingly vapes and other products in the media. It also includes exposure to seeing actual depictions of use in media. So people actually smoking or using tobacco products on screen, in print media, online, all of that, in YouTube videos, all of that actually affects the risk that an adolescent will actually take on that behavior. Use among peers, this will not surprise, I think, many of you who are parents, that use among peers absolutely makes a difference. So if your friends use some kind of tobacco products, you're more likely to have both exposure and access, so you're more likely to use as an adolescent. There are some data that high school athletes particularly tend to use more smokeless tobacco. And again, that constitutes using chew tobacco orally, using new formulations on the market, which are tobacco pouches, which can go in the mouth. That smokeless tobacco use may be a bit higher in high school athletes. And then the other piece that is also unfortunately true is that, yes, peers have a big influence on adolescents and their behavior, and parents absolutely still do as well. And so that means that seeing parents use any kind of substance, including a nicotine containing substance or a tobacco substance, absolutely increases the adolescent's likelihood of using. What about biological and genetic factors? This is a large category, but there are a few things that have been looked at that I wanted to mention specifically. So first of all, youth may feel dependent sooner. That means that physically, because of kind of where they are in terms of their physiology and brain development, which I'll circle back to, youth may actually get physically dependent more quickly than adults. And so that's a biological factor I think we have to keep in mind, and I think about when I see a young person in front of me who's just started using. Family history makes a difference. So if someone has a family history of smoking or a family history of any substance use, that can increase their risk of continuing to use tobacco product. And exposure during pregnancy also makes a difference. So throughout my career, I've also worked with people who are expecting and kind of in the pregnancy phase of kind of care, and also perinatally or postnatally, and exposure during pregnancy can increase the risk that a child will develop a future issue with using tobacco. So this is important to keep in mind. And finally, I've kind of lumped these together, not because they're any less important, but just because for me, they all kind of fit together. So what about the impact of mental health, of personal views and other factors? And well, this is what we know. We know that having a comorbid, which essentially in medical language means co-occurring depression or anxiety disorder, or just high levels of stress, who among us who has an adolescent has not had a stressed out adolescent, particularly during the pandemic, right? So having high amounts of depression, anxiety disorders, or stress can increase risk. Expecting positives from nicotine or tobacco use, so expecting it to help with stress or lead to weight loss or lead to better social acceptance, all of that will increase risk of ongoing use. Lower income and less kind of educational achievement can also be correlated with increased risk of use. Simply not knowing how to say no, so not having had any models or any examples of how to say no to their peers can also be a predictor of risk. Lack of parental support and environment makes a huge difference. We see across the board, parents continue to have a huge impact on adolescents and their interactions with the world and with substances. Even though adolescents may not like to hear that, parents still continue to play a huge role in their use. Accessibility and price of tobacco products absolutely makes a difference. Doing poorly in school and also having lower self-esteem are also predictors of ongoing use. So These are all things that I think really bear taking a thoughtful approach to and paying attention to when we're thinking about an adolescent who might be experimenting with any tobacco product or starting to use it in problematic ways. So, which factors affect adolescent tobacco use? I think most of you guessed this correctly. And the answer is, of course, a trick question, because I could have just put in all of the above as an answer. I did not, but you all are very savvy, multiple guess takers here. The answer is all of the above. So I wanted to give kudos to all of you. I see the conversation about Juul and kind of some of the marketing that goes on around newer products. That's something we'll talk about a little later too. So I've talked about a lot of the risks of tobacco. What can we do about it? Having gotten all of this information, and before I go on, what can we do about it? And feel free to put the answers in the chat. What can we, as perhaps as parents and educators particularly, do about tobacco use? Any guesses? This is a hard one, but what can we do? Amanda, great. Good communication with adolescents. I love that, and that's really, it sounds simple. I think you all know, if you all are parents or educators, that it is not that simple, but it is crucial. Good communication with adolescents. Talk with them. Yep, Myra, you say communication. Talk with kids about, Katie, you say particularly the negative effects. Yes, absolutely. Charlene, from a policy standpoint, pass laws to limit access for teens. I'll talk more about that. Education, legislation against flavored tobacco that has been shown to be effective. Explain its effects and make it less accessible. Yes. Stop smoking ourselves. Huge. I cannot tell you how many parents who I've seen quit successfully because they were motivated by wanting to keep their kids safe. So yes, and thank you, Beth, for pointing out to everyone that if you're raising your hand for questions, please save your questions for the end. I will have a Q&A at the end as well. Bridget, you say provide education, find alternative activities for students. You all are absolutely right on. So I'm going to continue and just support some of what you've said. There are some policies that can absolutely affect and reduce tobacco use. Higher costs for tobacco products, including taxes, absolutely reduce rates of use. Prohibiting smoking in indoor areas of workplaces, public places, schools, of course, all of that, and places adjacent to schools makes a big difference. Paying attention to what adolescents are exposed to in terms of TV and radio commercials, posters, other media messages aimed at kids and teens, very important. Community programs, school policies that really emphasize places that are tobacco free and also highlight lifestyles that are tobacco free as an option can also have a really important effect. And then community programs that lower, the advertising promotion around tobacco and make products less accessible are really, really crucial on a policy level. What about on an individual level? There are many, many resources out there around kind of tobacco, but I wanted to share some that I like, particularly these are freely available online. And I wanted to include them here. One is the Smoke Free Teen website. This is really excellent. It allows teens to kind of talk to, or parents to talk to experts or get resources in a variety of different ways, including texting or chatting in real time with an expert with questions, build a plan around vaping or quitting, connecting to Instagram. They have an Instagram account linked to this, and there are just a ton of print materials available on there, along with all of these different forms of interacting with experts. And so I think this is a great free resource. I really like the Real Cost of Vaping website. You can also Google this. This includes a number of resources that are helpful to look at, including a teacher blog on how to spot stealth and disposable e-cigarette use. This might go back to the earlier comment about using during school breaks and such. How to discuss e-cigarette and nicotine use with youth. So how to actually have those good conversations that I think we all agree are important. And then I really love this article about how to discuss e-cigarettes and nicotine addiction with youth. This is a really helpful article just talking about how to start having the conversation, right? And that can be one of the challenges. How do we even know when to or how to start? And I think this is a really useful article kind of just pointing to how to do that. So I also wanted to say that for people who would like to and feel like they need the help of a physician, it can be helpful to talk to a physician about some of the options, including potentially medications to help get away from a severe nicotine or tobacco use disorder. I'm not going to speak about medications at length in this talk, except to point out that the FDA has approved a few different things, and they're well studied for helping people, including older adolescents, get away from using tobacco or nicotine. So that can include nicotine replacement. That is the patch, gum, lozenge, inhaler, nasal spray, all different forms of clean nicotine. Bupropion, which is a daily or twice daily medication, and varenicline, which is a twice daily medication. So I won't speak a ton about medications, except to let you know that they're out there. And I think any physician would be able to discuss these as appropriate with you and or with an adolescent. Okay, so at this point, we are just about halfway through the hour. I'm going to transition to speaking a bit about cannabis. And I want to start with a disclaimer and this image. So cannabis has been in our communities for a very long time with different social and political implications and controversies. You won't be surprised to hear that I can't resolve all or any of those controversies for you during this talk. But my goal is to again share some scientific knowledge that might be useful for you in your conversations. So I wanted to start with this picture because this graph actually captures something that is really similar between both tobacco and cannabis. And I'm kind of using the terms cannabis and marijuana here a little bit interchangeably. But the takeaway from this graph, which captures data from a very large national study called the Monitoring the Future, or MTF study, looks at the relationship between perceived risk and daily use in high school students. So in this case, this graph shows percentage of US 12th grade students reporting daily marijuana use versus perceived risk of regular marijuana use. And you can see how that has changed over time. The biggest takeaway here is that you can see that the orange line, which kind of shows what percentage of high school students, 12th graders particularly, thought using marijuana was risky, you can see that as that line goes up and down, daily use mirrors it almost perfectly. This is true for marijuana. This is also true of tobacco, that if adolescents perceive a substance as being less risky, the number of daily users goes up. And this is important to pay attention to, particularly as we see more and more legalized forms of marijuana or cannabis. And as some of that advertising starts to look like early tobacco advertising, which is, of some concern. This brings me to my next cannabis question. Perhaps you all thought we were done with our questions. We are not, but I hope this gets you to some important information. So the cannabis plant contains how many different active chemicals or cannabinoids? We hear about a couple, in day-to-day language, but how many chemicals approximately are actually in this plant and in some of the products? The options are 1 to 5, 10 to 50, 51 to 80, or over 100. So take a guess. How many cannabinoids are contained in the cannabis plant? And feel free to take your best guess in the chat here. $10 to 50, 10 to 50, over 100, Monique. Charlene, you guessed 51 to 80, over 100. Okay, I see a few over 100. Thank you, Bridget and Judy and Myra. Well, let's talk about it, Cecilia. You guess on the lower end. So we're a little bit more split on this one. That makes sense because the questions do get harder in typical test-taking fashion. So let's talk more about it. This is a picture of a trichome. The word trichome comes from the Greek word for hair, and it refers to those small translucent outpouchings that you can see on this really magnified image. Now, this is the surface of a cannabis plant leaf, and the trichomes there, actually contain all of the chemicals that are secreted by glands inside the leaf that contain the different chemicals that folks, including adolescents, end up smoking or consuming in another fashion. So this is where all of the chemicals come from that are contained in different cannabis products from the plant and from these trichomes. And when we look at what's actually in there, it turns out there is an entire alphabet soup of different chemicals that are actually contained in these trichomes, and therefore in many cannabis products. So there's CBD, THC, but as you can see, many other chemicals. THC and CBD are the two most common ones that we hear about because they're the most well studied so far, even though there's a lot of research still kind of upcoming and ongoing about those two chemicals. But it's important to keep in mind that there are actually over 100 total different cannabinoids in the cannabis plant. And so even though we are talking about THC and CBD and many products are labeled with the composition in terms of THC and CBD, there may be and often are many other cannabinoids mixed in there, and we just have not studied them as well. I promised that I would talk a little bit about neurobiology and brain development, and this is really, really relevant for adolescents and any substance use, including tobacco and cannabis. And the important piece here is that the brain matures or myelinates from the back to the front. Myelination is a process by which nerves develop basically an insulating sheath around them so that they can kind of conduct impulses or electricity more effectively. So it's a marker for how developed a part of the brain is. You can see on the right there that the brain slowly turns blue, starting at the back of the brain and ending at the front of the brain. So that is the brain slowly becoming more and more myelinated or developed. And it is important that it happens from the back to the front because that correlates with age. So ages 12 to 14, adolescents are having their cerebellum become myelinated. So these are their motor skills. So this is where you see, young gymnasts or other athletes able to do really impressive coordinated tasks or sports because the cerebellum, the motor part of their brain, has become myelinated even at an early age. Later on in life, 14 to 18 is when the limbic system, which is the emotional and social part of the brain, gets more developed. So this is where you get, the increased emphasis on peer groups, friends, maybe early romantic or dating relationships. You get kind of the stereotype of the emo teenager. Well, this happens because that limbic or social emotional part of the brain develops at 14 to 18. And then finally, and I think this is really crucial, the frontal part of the brain develops 18 to 26 years of age. So this is the thinking or cognition part of the brain. This is the part that has to do with planning. It is the part of the brain in the frontal lobes that has to do with impulse control, executive function, all make good decision making, all of the things that we think of as being kind of a responsible adult. The frontal lobes are responsible for a lot of that. And it sometimes surprises people that that part of the brain doesn't fully develop till the age of 26, when we consider people to be adults beyond, 18 or 21. So brain development continues for a long time, which means brain development can also stay vulnerable for much longer than we expect to substances like tobacco and cannabis. And so that's all good to know in terms of kind of the theoretical, model of brain development. But what are the actual outcomes? What do we know are some of the outcomes associated with particularly early adolescent cannabis use of any type, right? So there are age and dose-dependent impacts on a number of things. And I just wanted to share with you some of what has been studied. Early use and regular use affects rates of high school completion, attainment of university degrees, rates of cannabis dependence at some point in life, is associated with other drug use, associated with mental health issues, including suicide attempts, depression, and later in life welfare dependence. So I want to pause here and put this in some real world context. Not every person, not every adolescent who uses cannabis is going to develop any or all of these all of these problems or these outcomes. They are possible, but not all of them, and most of them will not. However, I think it's important to keep these in mind on an individual level. So if someone is already struggling in high school or is wanting to kind of go to their dream university or college, I want to let them know the impact that cannabis theoretically might have on those achievements. If they want to move out and be independent and have a job and kind of, have their own kind of separate life outside of the home, I talk about the ways cannabis might affect their functionality, their mental health, all of those issues. So it's important not to take this data and use it as a scare tactic, essentially, but rather as a way of educating and talking to adolescents in a way that is really relevant for them and their individual values. So I want to just kind of mention that caveat. So the cannabis plant contains how many different active chemicals or cannabinoids? Several of you guessed this correctly. The answer is over 100. So I think many of us may have encountered some preparations of cannabis or seen advertisements for them increasingly. For any of you who live in California, we certainly have billboards with kind of cannabis products on them. And they can really run the gamut from kind of gummy bears or worms there in the top left to kind of vaporizers similar to those e-cigarette vaporizers that we saw earlier, to that kind of dried plant product that you can see at the bottom. And now I always let kind of anyone, adult or adolescent, who's using gummy bears or worms know that these look like candy. In fact, they are candy in a certain way. And so it's extremely important to store those safely, keep them out of reach of children, et cetera, because there have been cases where younger children have gotten into those and ended up in the ER. So it's important to be careful about storage. And then this is marketing. So the entire range of cannabis products is really heterogeneous. It's a whole set of different products: potato chips, butters, soft drinks, all kinds of products of different colors, meant to basically appeal to a broad market. There is also synthetic cannabinoid out there. These are illegal. However, they are out there and are often packaged in these kind of brightly colored packages. Some of the common names are Spice, K2, Joker, etc. I'm rarely a person who has absolute rules about everything, but this is something that I have absolute rules around. No one should be using a synthetic form of a cannabinoid. So if you hear about an adolescent or even an adult using one of these products, they're bad news. They're actually synthetic products that mimic natural cannabis but have much stronger psychiatric and physiologic effects, including psychosis, kidney, and liver failure, all kinds of scary risks. So synthetic cannabinoids are out there and they are bad for you, is the message there. These are some preparations just from what my patients have brought into my office. So I took these photos with my iPhone. There's no patient information on here, but you can see these are actually more kind of medicalized forms of cannabis. So they actually look like medical containers. They're labeled, you can see they're on the left with the percentage of THC and CBD. So it's important to know that this is also one form of marketing, to kind of put these in kind of medical packaging. Unfortunately, that medical packaging is often not accurate. So this is just a study that came out in 2015 and unfortunately has continued to remain true, which is that this group of researchers went and looked at cannabinoid dose and labeling accuracy in edible cannabis products in 3 cities, in Seattle, San Francisco, and Los Angeles. And they found that the vast majority of products were inaccurately labeled in terms of their THC and CBD content. So a lot of places that are doing this packaging aren't really closely monitored or kind of surveilled very much yet, don't have access to a lot of equipment to do that. And so the infrastructure hasn't caught up to the labeling, which means the labeling is often inaccurate. When it comes to cannabis and mental health, a lot has been written, and I couldn't hope to go through all of it, but I think it's important to talk about cannabis and the risk of psychosis. So what we know is that there is an association between adolescent cannabis use and risk of a psychotic outcome. Now, what does that even mean? What is a psychotic outcome? A psychotic outcome is an episode of brief psychosis, so changes in rational thinking and hallucinations and delusions, sometimes even paranoia. And that can happen either briefly or for a prolonged amount of time, and can be more likely in anyone, including adolescents who have a family history of schizophrenia or another psychotic illness. So for folks who have a family history of psychosis, this can be a particularly risky outcome. There's a dose-dependent risk, which means that the risk goes up, particularly with the dose of THC being used. Cannabis can, particularly with high THC products, speed up the onset of psychosis by about 7 years in those who have a family history of a psychotic illness, again, associated with higher rates of paranoia and hospitalization and lower brain volume. So in this case, I think it's just important, again, to pause and say that this is not the outcome for everyone or most people. However, some people with particular vulnerabilities and family histories should absolutely know that these are potential outcomes. And so for adolescents and adults who have any of that history in their family, I talk to them about the risks that cannabis could pose to them related to psychosis. So I showed you those medical containers of cannabis and kind of, it's being marketed for a number of medical diagnoses. But what has it actually been studied and approved for? So this is a question for the group. The FDA has approved cannabinoids for use in which of the following conditions? And the options are anxiety, glaucoma, seizures, complications of chemotherapy and AIDS, or pain and multiple sclerosis. Please feel free to put a guess in here. Amanda, you guess all of the above. Okay. See if for complications of chemo and AIDS, glaucoma and seizures. Thank you, Monique. Any other guesses? This is the harder question, none. Okay, Cecilia, you think no, nothing has been approved by the FDA. Rebecca, you guess glaucoma, just seizures potentially. Well, let's talk about it. You know, it's marketed for so many medical products, but what is it actually approved for? I see, Veronica, you guessed pain and multiple sclerosis as well. So let's talk about it. So when it comes to medical marijuana, I think it's important to know a couple of things. I'm a psychiatrist, so I was with the American Psychiatric Association in 2013, where we did a year-long review of all the research out there and said that there is no current psychiatric indication for a cannabinoid, but that is because of a lack of adequate research partly, and we said there needs to be more research. Lo and behold, in 2018, the APA did another review and actually became even more firm. They actually opposed the use of cannabis as a medication for psychiatric conditions. However, it's important to know that there are 3 approved non-psychiatric conditions for which a cannabinoid can be used. So that is nausea and vomiting related to chemotherapy, anorexia and wasting related to HIV, and rare childhood forms of epilepsy. So pain is not on there and glaucoma is not on there either. So returning to the FDA approval question, the FDA has approved cannabinoids for use in which of the following? Another trick question, several of you guessed these, but just to kind of reinforce that includes seizures and complications of chemo and AIDS. So this will be our last question on cannabis and for the evening, but we're talking about adolescence. So which of the following can increase the risk of developing a cannabis use disorder or addiction? Is it A or number 1, parental attitudes towards use, 2, early onset or adolescent use, 3, route of administration. So do they smoke it? Do they use an edible? Do they use it topically or regular or daily use? Rebecca, you guessed all. Any other guesses on this final question? Bridget, all. And I will say, I should clarify what has actually been studied. Not all of these may have been studied adequately. Amanda, you guessed all as well. Thank you. Charlene, you guessed early onset use. Cecilia, you guessed 2 as well. there's some great guesses, and this is a hard question, so let's talk about it. First of all, important to know that there are actually cannabis-related diagnoses. So important to know that we have medical, and in psychiatry, we use DSM, the Diagnostic and Statistical Manual, to actually define illnesses. And we have well-studied criteria for cannabis intoxication, cannabis withdrawal, which people can absolutely go through when they stop using cannabis, and cannabis use disorder, which is addiction. What about, how many people approximately end up being, developing an addiction at some point in their life? Well, when you look at all users, really a minority end up developing an addiction at any point in their life, about 9%. However, when you look at adolescent users, the number goes up. So these are people who started as adolescents. The risk of addiction at some point in life goes up to 17%. And then for daily users, depending on the study, 25 to 50% can end up developing an addiction at some point in their life if they continue to use daily. So the message here is that adolescent use and heavy adolescent use is particularly risky. What about treatments? There's not a lot to say here. There are small randomized controlled trials showing the effectiveness of some medications to treat cannabis use disorder, but none have been approved by the FDA so far. Treatment is really mostly behavioral, and there's no one best modality for treatment of cannabis use disorder or addiction in adolescents or adults, but there is good evidence for CBT, which is cognitive behavioral therapy, motivational interviewing, a form of treatment called contingency management, and really group therapies, similar to other substance use disorders, really remains the mainstay for a lot of this. So which of the following can increase the risk of developing a cannabis use disorder or addiction? Probably all of these, but the ones that have been best studied and I think are really relevant for you all are early onset and adolescent use and regular and daily use. It's important to be able to talk about cannabis and harm reduction with adolescents, or really with anyone who might not be ready to quit altogether, but might be willing to cut down or maybe avoid some risky forms of use. So in those folks, I think it's important to be willing to talk about, not just abstinence, but maybe avoiding early age use and protecting the brain as long as possible, avoiding high frequency use. If someone is going to use, trying to use lower potency THC formulations, totally abstaining from the synthetic cannabinoids that I mentioned earlier. Avoiding combustible products. For some people who have lung disease, it can be preferable not to use a combustible product, so that can be important, along with avoiding deep and risky inhalation. For adolescents and adults, abstaining from cannabis-impaired driving is really important because cannabis can affect the reflexes associated with driving. I mentioned some of the high-risk populations that should avoid use of cannabis, if at all possible, including those with psychosis and addictions in their families. And tracking use over time can be really powerful, including some metered dosing vape pens that let people slowly cut down on their use. So harm reduction remains really important. These are some publicly available resources on cannabis and data related to cannabis that I'll leave here for your reference. And I'll go to some take-home points on tobacco and cannabis before I wrap up. So both cannabis and tobacco use are risky for adolescents for the reasons we discussed. E-cigarette use rates remain quite high. Addiction to either substance is possible, to both tobacco and cannabis. Some adolescents may be at higher risk of harm. The adolescents with a history of addiction, history of mental health issues, including psychosis, etc. Many factors impacting use are modifiable. So we talked about the social environments, we talked about parental attitudes and honest communication, we talked about larger policies. Those are all modifiable things. So we should feel empowered to advocate for those changes. Avoiding early and daily use in adolescence when abstinence is impossible is really, really important. Behavioral treatments help with both substances. However, FDA-approved medications really only exist for nicotine or tobacco use disorder. Non-FDA-approved medications exist for cannabis use disorder, and that is perhaps worth talking to a prescriber about. And then really the most important thing to me is that honest communication, including harm reduction, remains really key, whether I'm talking to an adolescent person or an adult. So with that, I'll scroll past some of my references. I'll thank you all for listening, and I'm happy to take any questions. I'll turn it over to Charlene.
Well, thank you, Dr. Zaman. That was a lot to think about. And I really appreciate everybody's participation and all your great questions and quiz answers and everything else. So, Dr. Zaman, a couple of quick questions before we leave today. First of all, why is the myth that cannabis is not addictive so persistent, especially among kids?
It's a really great question. I think sometimes perception of risk has to do with how much kids are exposed to normalization of that substance. And I think increasingly adolescents are seeing normalized forms of cannabis use. So just, speaking about human psychology, if you see billboards for something, if you see others using, if you see that it's been legalized in your state, it's a lot harder to believe that it could be addictive or bad for you. So part of it has to do with that perceived risk that I mentioned for both tobacco and cannabis and how that's risky. The other is that cannabis has changed a lot over time. So the actual THC content is much higher now than it used to be, right? So it may be that adolescents have parents or grandparents who used cannabis at some point in their lives and didn't perceive it as being addictive or problematic. But what I tell people is what's out there now, right, is not your parents' marijuana or your grandparents' marijuana. The THC content is much higher. So it may be that the actual potency has changed over time, but the information about the risks hasn't necessarily caught up.
Well, thank you for that. So a parent asks about the connection between cannabis and mental health. She says that her daughter really feels that she needs to have marijuana for her anxiety. Does it really help?
Good question. The evidence isn't there. So what I'll say is this is something I hear in clinic every day, that I have anxiety or I have insomnia or I have depression, and really cannabis is all that helps. So there are a couple of things. One is, beyond that anecdotal evidence, no studies have borne out that cannabis is uniformly helpful for a mental health condition yet, right? So we just don't have that data yet. There are studies showing that cannabis can have what's called a kindling effect for some mental health issues, which means that in the moment, it can feel like it kind of numbs the feelings or helps with just the symptoms in the moment. It makes things tolerable. But overall, kind of like kindling a fire actually makes the depression and anxiety worse. There's something very relevant for everyone here, adolescents and adults, called amotivation syndrome, right? So people can end up more and more stuck, more and more apathetic, more and more stuck in the couch or in their rooms and less functional, even though their anxiety might subjectively feel better. So it's really important to pay attention to both the kindling effect and functional, how someone's doing functionally, not just how they're feeling in the moment.
Okay, good advice. So there's some questions based on your discussion of how some rates of use dropped during COVID, but now that kids are back at school, are those rates going to go back up? And how are they able to buy e-cigarettes? Or is it at school?
I've certainly heard of it happening at school. And unfortunately, that's one of my fears, that, there are so many horrible effects of the pandemic, psychologically for us as a society, medically, right? But the silver lining for some adolescents has been being in these controlled environments, enforced controlled environments with adults, often with their parents, without access and with close supervision, right? So
Right.
I fear that without that, there might be risk of more exposure and use, including potentially purchasing from other adolescents, perhaps older adolescents who are kind of above the age of kind of purchasing. Adolescents get a hold of them from adults. That's part of the move behind, or that's part of the push behind trying to get rid of the disposable forms of e-cigarettes, because they're particularly easy to pass around and get a hold of. So I do worry that we'll see an increase of use as adolescents go out into these unmonitored settings.
All right, well, we have heard a lot of information today, and we are thrilled to have online with us some of our favorite partners and mental health and school partners in terms of counseling and psychology. So Dr. Zaman, what kind of final words do you want to leave us with today?
I would like to leave with the part of the silver lining that could continue for all of us, because I will say, as incredibly hard as it has been for parents or caregivers and adolescents to be kind of cooped up together and having that been enforced, part of that has also forced some important communication and some honest communication. And my hope is that those positive parts can persist even into a post-pandemic world.
That is a great place to end. And that has truly been a silver lining for the pandemic. So huge thanks to you, Dr. Tauheed Zaman, for all the wonderful insights and advice today. Thank you to everybody who is online with us with great questions and comments and insights. This video will be available soon to those of you who registered and those of you who are involved with the Parent Venture. We thank you so much, Dr. Zaman.
Thank you.
And to all of you who joined us tonight, take care, everybody, stay well, and we hope to see you again soon. Good night.